Today's guest is Dr. Emily Splichal, functional podiatrist and human movement specialist. She is the mind behind Naboso. She has taken her conventional medical degree in podiatry and combined it with years of experience and expertise in human movement and sensory science to found Naboso. She believes that our experience in this world is built around sensory stimulation and our ability to process, perceive, and integrate this information effectively. Since 2012, she has been traveling the world to share her unique approach to human movement, foot function, and barefoot science. Having taught in 35 countries and in over 25,000 professionals, she has quickly become a sought-out leader in barefoot training and rehabilitation. Welcome to the Dangerous Women podcast, where the intersection of fierceness and femininity fuels empowerment. Our goal is to provide women with insights to unleash their power. Grounded in the 7 principles of self-confidence, we guide women to embrace their duality, delicate as a flower, yet powerful as a bomb. I'm your host, Colleen Conlon, inviting you to join me as we explore topics on health and wellness, empowering you to embody the essence of your dangerous woman. Emily, how much does the foot health impact our overall health?
I mean, our foot is our body's foundation, so it's very influential, I would say, from a movement perspective, but actually a lot of medical conditions will actually present first in the feet, or you can start to see signs of various medical conditions in the feet. So yeah, the feet are powerful and very much incorporated in everything that we do.
And how much does the foot impact how we move?
So I like to look at the foot, which is our body's foundation. You could think of the foot as the only contact point between the body and the ground. So that's our foundation, but in 2 primary ways. One is going to be mechanical, and then the other is going to be sensory based. And both of them are really important to appreciating the foot and then understanding how to strengthen the foot, recover the foot, footwear, just how all those things impact the body. From a mechanical, that would be really, think like the foundation of a building. That if the foundation of a building is not stable, the rest of the structure can't be stable. It's essentially the same thing, right? Best example of that would be if someone had flat feet. So if the feet are collapsing in, then you start to see the legs rotate in, the knees knock in, and the pelvis rolls forward. So you start to see that collapse go upward. And then from the sensory side is the foot being the only contact point between the body and the ground, you have this very powerful system of nerves in the skin in the bottom of the feet, which is what's touching the ground. And then that actually talks to the rest of our muscles, to our brain, to our body, and it's how we relate to movement. It's how we relate to our body in space, to gravity, to sensory stimulation. And there has to be a continuous interplay between both aspects. You can't just look at the foot mechanically. And you also can't look at the foot just sensorily. It has to be a blend of both.
I think it's incredible that you share how it's our foundation and it impacts the rest of the chain of the body. So is it possible to say if I'm having dysfunction with my pelvic floor, it's possible that it could actually be coming from my foot?
Absolutely, 100%. And the reason is because your pelvic floor is connected to the muscles in your feet, and that is through different fascia lines. That's actually where a lot of my work is in, and it's in what I call foot to core sequencing, or it's really getting the intrinsic or the deep muscles of our foot, your foot's core, to connect to your pelvis core or the pelvic floor. And there's very powerful fascial connections. We know that if your pelvis is in different positions, that it actually affects your ability to engage your pelvic floor. So the example I gave earlier of flat feet or overpronation, which causes your legs to rotate in, your knees knock in, when your pelvis rolls forward into an anterior tilt, that's actually a pelvic position that is difficult to engage your pelvic floor. You need it to be more either neutral or even slightly posterior. So that's another way that it can affect what is happening in the pelvic floor. But yes, in my profession, I actually work with many pelvic floor specialists who they really want to understand that connection and then utilize it with their patients.
So, if for some reason a pelvic floor physical therapist was just evaluating the pelvic floor, was trying to figure out what could be causing this lack of connection or dysfunction, and they can't figure it out, it could be because it has nothing to do with that immediate area. It has everything to do with a neighbor that's all the way at the bottom of our body.
Yeah. And I see that a lot. And most of the patients that I see, I'll actually get patients with pelvic floor issues, and they're coming to me. No, I'm a podiatrist, but they're like, I need someone who's thinking outside of the box. And the body is so connected. They'll probably see something on the internet somewhere, kind of peripherally talking about this connection. And then they're saying, okay, I need to go to someone who's not going to be. Sometimes we can get very pigeonholed, and that's the trouble with being a specialist, is that I'm sure pelvic floor specialists, not all of them, but would be like, okay, this is your typical, inhibited pelvic floor from, and they kind of see the same thing. I see plantar fasciitis all the time, right? It's the same thing, right? That you need to step away sometimes and look and say, okay, I'm going to pretend that I don't know anything so I don't bring in bias into this. Think very much, broader picture, really listen to the patient, ask a lot of questions. And then that's where you can start to see like, okay, the issue, I don't think is really even here in the pelvis and the pelvic floor. It's somewhere peripherally that I need to look at.
Mm. I feel like that could be a really challenging thing for a patient to come to terms with. You're expecting this is where I'm having the pain, this is where the trouble is, but it's actually something that you never thought was interconnected. You just brought up plantar fasciitis, and I'm curious, what are some of the most common foot problems that you run into? And what are some of the most common, like, quote unquote, if you're not watching the video right now, I'm giving like bunny fingers. What are some of like the quiet, common things that could be wrong with our feet that we might not even be aware of until it's too late or until we're really in pain?
Yeah. So the most common conditions that I would say a podiatrist would see, but then me as well. I just have a very unique niche boutique practice. Definitely plantar fasciitis, or you could say heel pain. Heel pain is actually very broad. That could be plantar fasciitis. It could be a periosteitis, so the fascia that wraps around your heel bone. That is where the itis could be, not really in the plantar fascia. Obviously, your Achilles tendon is coming down there as well. And then you have nerves that cross under your plantar fascia. So sometimes you actually just have an entrapped nerve, which is this heel pain, and it can be misdiagnosed as plantar fasciitis. But that heel pain area is one of the most common presentations. I would say the next most would be bunions, which of course I'm sure we will definitely be talking about bunions because there's so many questions about bunions. Bunions are definitely one. Bunions are one of the biggest contributors to stuff up in the pelvis. So
Mm,
that could be low back pain, SI joint pain, things with the pelvic floor, deep hip stabilization, because your bunion or anything with your big toe is going to change the way that you walk. And if you can't take long steps with good rotation of your upper body, swinging arms, because you have no range of motion or you have pain in your big toe, well, then that's going to destabilize your entire torso, and then it leads to a cascade of events. I would say one other common one that we will see is something with a neuroma. Maybe it's a Morton's neuroma, it's an entrapped nerve in the forefoot, and that can be very painful. Some of the ones that are probably quiet, I mean, I would probably say it does go to like that heel pain. It's just that we are thinking it'll go away the next morning, or you can walk it off, or it's no pain, no gain,
mm.
something like that, that you definitely can sometimes take that mentality. And then I would say issues with the big toe. Typically, I do not see issues with the big toe until it is a little bit, not too late, but it's in the later stages of arthritis. So anything with the foot is really about listening to the body. That's for everywhere, not just the foot. But when your foot starts to talk to you, is what I call it. And maybe it's because of shoes that you're wearing. You just have to listen to your foot as it's talking to you, and oftentimes change your footwear. So it is the accumulation of stress that is what essentially pushes you past this tipping point. And it's really interesting once you understand that everything in the human body, as far as the musculoskeletal system, is based around tissue stress theory or tissue stress threshold. And essentially, you're stressing the body from working out. You are lifting weights. When I would do a lot of aerials, I would feel that I'm pulling different tendons and ligaments in my body. Or maybe you stand a lot or you walk a lot. So you're stressing. Okay, then the next day you're stressing, and it essentially starts to accumulate. And as soon as it hits a threshold, boom, that's where you get the injury. That's where you rupture the tendon or you get an acute plantar fasciitis. And our goal is just to understand the body, listen to those signals, really focus on recovery. Recovery is one of the most important things that we can be doing for our body, and understanding really what does recovery look like and what does that mean, so that you can bring yourself back down to a baseline. So the next day when you wake up, you do the same thing again and you stress the body. And then at night, you bring it back down. Next morning, you stress the body. And it's really an art of just figuring out how to do that.
You're so amazing. Everything that you just said, I have like all of these questions popping up in my head. But one thing that you did mention early on when you started talking was listening to the signals of pain in the foot. So if I'm experiencing discomfort with my feet, how long should I wait until seeking professional help?
Yeah. So I would, if your foot is talking to you and you have pain, let's say it's between a 1 and a 4. So it's more annoying. You notice it. Maybe it stops you at the end of the day and you sit down and just relax versus go to the gym. Let's say it's kind of at that point, right? So 1 to 4. Then I would say starting to incorporate releasing your feet at the end of the day, toe spacers. There's lots of different things that we can talk about. Looking at your footwear, do you need to use temporarily an arch support to just give your foot a little bit of a timeout and a break? Do you want to ice it? Do you want to do anti-inflammatories? Do you want to do red light? So what are you doing? And if you implement that for a good week, so I'm very much about consistency. You have to
Mhm.
be awesome about it for 7 days. Every day you're doing this little protocol, even if it's your protocol, and you're doing it for 7 days. If you get no better or even worse, then that's when I would go see someone.
Okay. That's great. I think a lot of times people are like, "Oh, I'm not sure if it's like bad enough that I actually need to see someone," and that's when we can really get into trouble.
Yeah. So it's much easier. So as a podiatrist, it's much easier for me to handle a plantar fasciitis that is like a 1 to 4. And they're just like, it's more like a toothache, kind of annoying, versus when it is an 8 out of 10, 10 out of 10. And they're like, I literally am limping everywhere. And I'm like, I have to give you an injection, or I need to. So then it just becomes much more difficult to manage. And then honestly, with anything, when you get these flare-ups, the more flare-ups that you get, you start to create this accumulation of stress, which creates degeneration. And that's really what you're looking to avoid, is degeneration of the tissue, because then that's a different animal that becomes more regenerative medicine. And that's when I have to do stem cells for patients, because they've just continuously neglected, let's say, the plantar fasciitis, and they're like, no, it'll be fine. I do my little protocol, then it goes away, and then okay, a month later, here it is again. And they're kind of self-regulating it on their own so many times that now it's really thickened, it's degenerated, and it might eventually tear. So I'm always on the side of educate yourself, get a professional assessment, even if it's just so that you can understand what's going on. Imaging is always good. And then that's really where that no pain, no gain comes in.
And talking about those three conditions, plantar fasciitis, bunions, and neuromas, how different can they look if it's, I'm at a 1 versus I'm at a 10?
So again, plantar fasciitis seems to be the easiest thing to talk about, but a plantar fasciitis of a 1 is, again, it's just annoying. It is just like background noise, but you are able to still go to work, do your workout even. Maybe you feel it the first step in the morning and then, okay, bye, you kind of started your day and then you like completely forget about it until you're at the end of the day and it starts to show face again. Then you're like, yeah, that's right, my heel hurts. That's kind of like that one. 10 out of 10 of plantar fasciitis or heel pain would be something where it is a sharp stabbing every time you step down. These are people who eventually have to take time off from work. They have to take a medical leave. They have to move a job from standing to seated. There's definite activity modification. They no longer go out. They can't walk the dog anymore, things like that. So that's where you're kind of grading it. That would be very similar with, let's say, a neuroma, because neuroma will be a sharp stabbing pain as well. Is it could just be annoying and then you feel it maybe every, maybe once an hour of the random steps that you're taking, you're like, okay, versus one that is, you can't even go to the bathroom in the middle of the night without a stabbing pain with every step that you take, as an example, right? Bunions would be similar. Bunions do have a lot of pain because you have bursas and joint pain and, submet pain, and they're a little bit different because they're not like right there is the pain where you can push and like trigger it for it because it's more of a joint. It's a little bit different. But yeah, so that's where it's really important to understand how the body is talking to you, how much is it modifying your daily activities, and then, right, if it's clearly giving you a signal where you were like, I can't go to work today, you really need to see someone for that.
And then are these conditions preventable or inevitable? I remember, Emily, I remember about 12 years ago, I was having all of this like pain with my big toe. I saw a podiatrist and the podiatrist was like, "Yeah, based on your foot, like of course you were going to form a bunion. It's inevitable." Is that true or not?
Somewhat, yes.
Okay.
So I was just in Denver doing a foot typing workshop for uh, people, consumers, not professionals, consumers. And it was all about teaching them, what does a flat foot mean? What are certain things that can result from a flat foot? Why do they get bunions? So it was essentially the same thing. So we went through and they were like learning to assess. And I was like, why I'm teaching this is that I want you and you and you and you to own your foot type and to really
Mm.
know and understand what it means. So when I say, or someone says, oh, you have overpronation, well, what does that mean? How does that affect the rest of the body? How does that affect the pelvic floor, the lower back?
Mm.
What injuries in the foot and the rest of the body are you uniquely susceptible to? And then what can you do to never get there? And that's part of owning your foot type or owning your body, owning your health, is that you say, okay, I have a high arch. So I understand that if I don't do daily foot mobilization, it's very easy for me to get plantar fasciitis or for me to get a stress fracture or for me to, right? And that's just saying, I understand it. This is going to be my unique daily routine so that I don't get injured.
That's amazing. How do we all learn?
Oh.
No, but really, I mean, I don't think people understand how unique all of our feet are. And then when we add in our health history, when we add in what our lives look like, because no lives are identical, we really can do a good job at preventing potential issues down the road, or at least
100%.
figuring out the solutions to manage what is inevitably going to happen.
And I think that I agree with you 100%. And that's really where preventive medicine, functional medicine, longevity medicine, this whole era that we are in right now is owning your body, owning your health, and then understanding what you can do. It's, we're talking a lot about musculoskeletal, but it could even be, maybe someone has anxiety and saying, like, okay, part of me being anxious, which I'm anxious, I tell you about this. My name's Emily and I have anxiety.
Guess what? My name is Colleen and I have anxiety too.
Right, exactly. So it's like, these are the triggers, these are the things. It's very important for me to know what helps me stay connected to my body to navigate the anxiety so that, right, it's just about owning the diagnosis, not being like, my name is Emily and I have anxiety. It's more like, no, you know what? One, millions of people have anxiety. So it's part of being human is to have all these conditions, right? So it's just like, hey, you know what? So do you. Yay, high five, we're twins, right? So having that and saying, okay, for me, exercising is very important for me from a mental health perspective, right? And doing exercises that I'm very in touch with my body. So it's lifting heavy weights is really important for me for how I manage and connect to my body through movement. But it could also be like, okay, I make sure that I take time for myself every night. I do a hot bath every night. It's just same thing here with our foot. I have an overpronated foot. So that means that I need to make sure that I choose smart footwear. I release my feet. I make sure that I understand how to find neutral, how to do short foot, how to really engage my foot with my pelvic floor and what my posture, how to strengthen my glutes. It's essentially the same thing.
What would life be like if you could get that toned look? You could have physical superhuman strength by training with just 2 kettlebells at home. What would happen if you were on a program that strengthens self-awareness and courage so that you can develop a deeper connection and trust to self? What about this? What if you could be in a community with other women where you are encouraged to be assertive and resilient to build mental and physical strength? If you're waiting to hear what the offer is, this is it. Swing to Snatch, a 13-week kettlebell intensive, is my signature course that empowers women to get started with kettlebells. Work with me live in a virtual container guaranteed to grant you kettlebell queen status. To learn more, visit www.colleenconlon.com. I love that. And I think it's really one of those things. It's just like, you don't know what you don't know.
Yeah.
And it seems like there's so many things that we can do to help ourselves in regards to our feet. And I'm hoping a little bit later on this episode, we can talk about some of the amazing tools that you have created that can help people with their feet.
Absolutely.
Can you, and I don't want to spend too much more time talking about plantar fasciitis and these different diagnoses, but are they all curable, or does it get to a point where it's like, we can't cure this, but we need to figure out how to manage it so that you can function in life?
Yeah, and I actually like that because sometimes people will then say, with plantar fasciitis as an example, if they've had it, let's say when they were 20, they had a history of plantar fasciitis. That's not a diagnosis that follows you on your medical records, right?
Okay.
So it's not like, let's say if you had rheumatoid arthritis. So that's something that follows you on your medical records, right? So that's something that's kind of disclosed. You will have to manage that to some capacity for your entire life. But having something like plantar fasciitis is not that. So can you cure it? Sure. I probably don't use the word.
She's giving like those little quotation bunny
Yeah, the
marks.
quotation. Yes. Here, I'm not curing plantar fasciitis, but it is a moment in time that you have this transient stress in that connective tissue. And how do I help your body repair the little micro tears that occurred and bring good, healthy organization to the connective tissue so that you never experience this again? That's more of how I look at foot conditions and will refer to them. Bunions, again, a little bit different because I guess you could say you cure it through surgery because you've then corrected the bunion, but then do you always have to deal with, some of the instability? So I would say take the information in about the foot, about your foot type. Maybe you have a bunion, maybe you have some hammer toes, and just kind of say, okay, that's part of my structure. How do I work with that structure? How do I manage it? How do I make sure it doesn't progress? What's the effect if it does progress? Okay, so that's why I'm going to stay on top of it. That's kind of how I try to have that relationship. It does become a little bit more difficult when I deal with neuropathies or neuritises and things that are chronic diagnoses, such as complex regional pain syndrome and things like that. Those are a little bit harder because those do follow a patient throughout, right? They'll say, okay, I've had neuropathy in my feet for the last 10 years or whatever it is. So that is something that will kind of follow them. That's navigated a little bit different. And that's very difficult to quote unquote cure or reverse just because of the chronicity of that diagnosis.
Thank you. I think all of that's really helpful to hear, especially knowing that some of these things do follow us, other things do not follow us, and there are action steps to take along the way. Emily,
Yeah.
can you tell us about footwear and making smart choices? Is it possible that, we are making poor choices just because there's a shoe that looks really cute and we just want the cute shoe? Are there cute shoes that are supportive, that do help us? Who should be wearing what and when? High heels? Can we talk about the high heels? Can we talk about those shoes that have like the finger toes? You know what I mean?
Yeah.
It's like
Yeah,
the
yeah.
finger sock toe situation. I remember that came out and I was like, what the fuck is this? Can we talk all things shoes?
Yes, absolutely. So one, shoes are, so what I would say is your foot is designed to function without shoes. Let's just say that, right? Some people have, again, this overpronation or certain foot imbalances that footwear can try to balance or minimize the stress to the foot. Again, so it depends on the foot type, the injury history, etc. So having said that, when I recommend footwear to people, it is based off of three things, and this will hopefully help the listeners. And this is typically around like sneakers or
Okay.
like day-to-day stuff. This is not cute shoes. We'll talk about cute shoes in a moment. So when you're thinking about it is what's your foot type? So high arch, flat foot, neutral foot. So what's your foot type? What
Are
is your
those
injury?
those are the only types, correct?
Those are the main buckets.
Okay.
So higher arch, although there's two different types of high arches. Cavus is the word for that, but we'll just leave it at high arches. Neutral, and then there's flat feet. Flat feet actually has various different types. Flat feet could be a pancake foot. Flat feet could be because your muscles are weak, or flat feet could be because of ligament laxity. So it's a little bit more complicated, but at that, so you have your foot type. That's the first thing to determine appropriate footwear. Second is your injury history. And that's very important, right? So if you've had recurrent, we're just going to stay with this plantar fasciitis, my goodness, plantar fasciitis for on and off for 10 years, et cetera, that's a different animal than someone who has the exact same foot type and has never had a lick of pain in their life in their foot. Totally different conversation. Third is going to be what is the stressor that you are using the shoes for? Meaning, are you a nurse and you're going to stand on your feet 12 hours a day on concrete? That's a totally different recommendation for me than someone who sits at a sitting desk and whatnot, right? Or like running. So if someone says, okay, what are shoes? So when I do kettlebells, even though I think people should do kettlebells barefoot, but
I do too.
kettlebells,
I do too.
is doing that versus running. That's a different stressor on the foot. So that's part of the story, right? Now, having said all of that, for the most part, I support minimal shoes, meaning Vivo Barefoot Zero shoes. Paluva is actually a brand that has the 5 toes. The other one is Vibram. There's Origo, Field Grounds. There's so many different brands, but that's generally what I like. And the reason is that I want people to get as much sensory stimulation. I want that freedom of movement. Can you twist your shoe like a rag? That allows freedom of movement, fold it, twist it, whatever. There's not a lot of
Pop
cushion.
it.
Yeah, pop it, all that. There's, there is, that is your ideal. Now, let's say you have a neuroma, you have ball of foot pain, you have arthritis in your big toe, something in the ball of your foot, forefoot. Then I might actually recommend Hoka. And I know people who follow my work, I think their heart skipped a beat or they like, oh my God, the first time they heard me recommend Hoka. but it's because I have to weigh the risk and the benefit. My goal is movement, not just, okay, what is this footwear that I'm mentioning? I need someone to walk the right way. And if you have pain every time you take a step or you don't have range of motion in your big toe, you will not walk the right way, period. Just no argument around it. You will not walk the right way, which means it's going to mess things up the rest of your chain. So that's where you look at it. Now, when it comes to footwear in general, because I know you want to talk about high heels, it is that I also take very much of a realist approach. And I call it where you only live once. So, I lived in New York for 20 years, very much about fashion. I lived there in the 2000s and like Sex and the City era. Everything was totally different. Now athleisure is very trendy. Athleisure was not trendy when I was in my 20s. So understanding that if you go to a wedding, if it's Friday night and you have a date, then you know what, by all means, wear your heels, but make sure you recover your feet when you get home. Don't wear them the next day. Wear smart shoes. You're doing the recovery component, right? Because all footwear, even minimal footwear or a supportive New Balance, all can create stress on the foot. And it's just about the variability of the stress. So always alternate your shoes. That is another really good recommendation. Is alternate your shoes, alternate that stressor. And again, they have written articles about me in high heels, and I was always the podiatrist that would take the approach of like, listen, women are going to wear, and men wear stilettos anyway. So let me teach them how to recover their feet and how to get back to baseline when you are going to wear them. Because honestly, all the other podiatrists, the female podiatrists, at a wedding or like a banquet, all of them were in their freaking 5-inch stilettos. And I'm the only one who was bold enough to tell people wear your high heels. So just do your recovery after.
A fun fact, if anybody is meeting Emily for the first time, she actually taught Oprah how to walk in high heels. So she is the expert in regards to like actually strutting her stuff in the heels and recovering from high heels. So can you tell us a little bit how do you recover from wearing a high heel? What does that look like? Does it change depending on your foot type? Is there any one thing that everybody, regardless of having a high arch, a flat foot, or a neutral foot, would benefit from?
100%. So if you think of stiletto, you are it's a plantar flex position is what's called, the ankle's plantar flexed. So that in itself is going to tighten your calf muscles. So that means at the end of the day, after wearing the heels or the next day, is to make sure that you are releasing the calf muscles. I actually focus much more on the soleus, which is the lower part of the calf. And because your calf becomes your Achilles tendon, which runs into the bottom of the foot, that's your plantar fascia, which came back into the conversation again. You want to make sure that you release the bottom of the foot. So that would be a bottom of the foot massage, neuroball if you want, and then a calf foam roll, stretch, release, Theragun, whatever you want, but you're trying to mobilize that. In addition, because you are in a narrow shoe, pointed shoe, whatnot, there is going to be some inherent toe contractures or constriction. So using toe spacers, something that's going to open up and spread and essentially reverse that constriction, is really, really good. I would also not stop there though, because when you go into a high heel position, you inherently have no choice but to tilt your pelvis forward. So you are then tightening all of the muscles in the front of your pelvis, your lats, all the lower back muscles. So doing some really good hip opening, whether it's like a hurdler stretch or do certain yoga poses that you really like, or if this sounds like way too much, then just take a yoga class the next day after wearing heels. I don't know what it is, but something where you want to think pelvis is going to be tight, calf, ankle, bottom of foot is going to be tight, and then my toes are going to be restricted. If you do that reset, then that is going to help essentially reverse that.
That's really helpful to hear. Thank you. Lots of different options right there to make sure you can wear the shoes that you want to wear and feel good throughout the process. Emily, would everybody benefit from like not being in shoes? Like, is there ever a time where you're just like, you know, I want to prioritize barefoot over being in a minimalist type of a shoe?
I think everyone benefits from at least 30 minutes of barefoot sensory stimulation a day. Now, that could be, getting ready in the morning. That's your barefoot kind of time, or at the end of the day, or I like things where you can do something and get several benefits out of it. I'm a big fan of earthing and grounding. So
Mm,
if the listeners are not familiar with that is, earthing would be essentially standing outside on dirt, grass, and you're essentially kind of connecting to the earth. And there's a lot more into it with like polarity and stuff. But if you could be outside a few minutes, you're getting the earthing, you're barefoot, you get the stimulation, all that wonderful stuff. But yes, everyone should be able to do that. Now, I do see the outliers and the 1% of the injuries where they have very serious ligament injuries, tears to their post tib, their foot is completely collapsed down. So there are some exceptions to that where if that's how they were presenting and they had a lot of pain, then I would say, okay, can you, when you're sitting, maybe have your feet on an Naboso mat? Could you put your foot on a power plate and the vibration would stimulate the feet? You still want to do something somehow. How are you going to get that stimulation? So it's kind of yes, but there's a couple outliers.
I feel like anytime you are really like going deep on something, there's always a yes, but, or it depends. Can you tell us about Naboso and the incredible products that you have created?
Yes, so Naboso, and I'm going to show it, but I will explain it if someone is just listening to the audio. So Naboso is a neurosensory product line that I started 5 years ago, and essentially all the products have a texture on them. So on the video, you can see there's little tiny pyramids. Or if you're listening, imagine little 1.5 millimeter pyramids across the entire surface of every product that we have, whether it is insoles, socks. So this would be the inside of the sock. So you can see the texture, it's on the inside of the sock. Release ball, I have the Neuro ball, Neuro stick. We have mats, we have flooring, we have wobble boards, weighted sticks. We have a whole product line of textured, little pyramids, textured products that are stimulating the nerves in the bottom of the feet and the palm of the hand. And really why I developed the product line is I was trying to find a way to help people wake up, connect, strengthen, feel, recover their feet, more so beyond than just taking off their shoes. And that was for the longest time, that was a big part of my message. This is 2008, 9, 10, 11, kind of those years, early to 2000, or sorry, late 2008, 9, 10, when the barefoot running boom was happening. And that's when the 5-finger shoes came out, is everyone started thinking about footwear and their feet and like, okay, I should be in minimal shoes or I should be barefoot. And I was really very loud behind that message. And I consulted with almost all of those footwear companies as the human movement functional podiatrist person kind of going into it. And then I started realizing that that wasn't the whole story, that we needed more, that our foot actually responds to even more specific stimuli. So getting into the research, I started learning about texture. And one of the other stimuli that is incredible for the feet is vibration, which is why I love vibration platforms. But textures is another one. And then that's where we developed all the different products. Now, all of the products from Naboso fall under performance. So it will help you perform better. We have a lot of professional athletes that use them in every sport. In wellness, so that could be just day to day, you stand on your feet for work, maybe you just had a baby, maybe you have our plantar fasciitis is back, you have that, so you're trying to use it for that. And then on the medical, we actually use it a lot with neuro rehab and neurological conditions. So stroke, MS, Parkinson's, autism, cerebral palsy, spinal cord injury. There's a lot of really, really incredible neurological injuries that when they bring texture a very specific texture to the feet or to the hands, it has a really profound effect on how they control their movement. So that's been a really, really awesome application that we see.
That's incredible. It really does sound like anybody would benefit from this product line.
If you have feet or hands, you will benefit.
Yeah.
Yes.
What would you say are a few of your favorite products? And specifically, is there anything that sets them apart? It sounds like they all have a very similar overall message and benefit, but is there anything that specifically sets them apart? And specifically, I have your toe spacers. I use your toe spacers for everything that I do. Most of my clients also live in your toe spacers. One of my clients was like, "Oh my gosh, Colleen, there was a woman talking about toe spacers in the New York Times recently." And I was like, "Yeah, that's the woman that you got your toe spacers from." um, but a couple of your products, can you just share them with us? What are the specific benefits to using each of them?
Yeah. So the first one, I'll show the neural ball, which the neural ball is a ball. I'm gonna have to stand up for this. So sorry for my lack of preparedness.
No, you're great. You're
But I
great.
have to. I
It's
know.
authentic.
So it's a ball that then splits into two pieces. So you have two domes, and then there's a little ball hidden inside, which is fun. And this allows you to release your feet. Having a pinpoint pressure release to your feet is actually much more effective than rolling. And almost everyone is like, yeah,
Wow,
roll on a
really?
lacrosse ball, a tennis ball. Yeah. So standing on these, you get the pinpoint pressure, you get the texture. So the texture, which is stimulating the nerves, is waking up the muscles, waking up the circulation. It's obviously acting like a massage. So there's so much benefit to these. And what I not joke, but just reality is working with feet for so many years is people are not going to do anything for their feet unless it's easy. Like their intent is the best. Day one, day two, it totally drops off. So this is something that you can release your feet. I tell people to leave this in their bathroom open
Mm.
and then stand on it when you brush your teeth. And it literally takes 2 minutes to release your feet. So that one is really, really easy. This is definitely our top seller is this, because it's one way to really understand the texture and how it feels. My second favorite, and these are all just my favorites, but is our sock. So the sock, this is the texture on the inside. And if you are listening just to the audio, again, imagine a sock that has little tiny pyramids across the inside of the sock. So what's touching the foot are these little pyramids. It's like little fingers massaging the foot. I wear these every night at the end of the day. And when I have shoes on all day or whatnot, then you walk around in these, there's grips on the bottom. It feels amazing. And even if you didn't use the neural ball and you're like, oh my gosh, I'm so lazy, just put the socks on and it'll be a part of your foot recovery, increasing the circulation, waking up the nerves, all of that, which is awesome. My third favorite, which I don't have, which I can't show you, I apologize, is our kinesis board. And our kinesis board is a small platform. Imagine something that just one foot would go onto. It has our texture on top, and then it's a wobble board, but it wobbles in a really micro way
It's like a
that
bat board.
it's it has little foam pieces on the other side,
Okay.
underside that makes it wobble, could say. And then why I like it so much is that it's part of my story on we need to be able to balance on one leg, which is my whole other passion is around balancing. But being able to stand on one leg, being able to feel your feet, most people do not do balance anything and they just assume because they're 30 they have good balance, but that's not the case. It's really important to how we walk. It's how you walk fast. So it's a product that we launched a year ago and it is one of our top sellers because of just the ease and the utility of it. A lot of athletic trainers, Pilates studios, etc., love the board because it's so compact. And then if you can train your balance on something that's literally just the size of your foot, it's just so easy. So pack it, take it on vacation with you if you want. But those are my three favorite products, and that's called a kinesis board.
I
So
love that. How many products do you have at this point, Emily?
we have over 40 SKUs.
Oh my gosh. And then where is the best place for people to go to check it all out?
Yes, so that would be our website, which is naboso.com. So it's naboso.com, naboso.com. And if you want to learn a fun fact, is that Naboso is Czech for barefoot.
I was going to ask, where did you come up with the name? I'm sure it means something, maybe a different language, maybe it's the root of something, but okay.
Yeah, it's actually a Slavic word because it's also Polish and I'm Polish and it means it, but it was meant for its Czech origin, but it's a Czech word. And then just so that the listeners have one other fun fact is in Korean, if you say Naboso, it means look at me. So there you go.
Emily, it's been so fantastic to have you on this episode. Thank you so much for being here. Do you have any closing thoughts for the listeners on feet health overall?
Yes, so I would say definitely by implementing even one or two very simple, consistent habits that you do for your foot health will honestly take you so far, and it will keep your posture, your movement, foot pain. It'll keep the podiatrist away if you want. We're not fun people anyway. So it's release your feet. Think about something. Toe spacers are super easy. Releasing your feet is super easy. Going barefoot at least 30 minutes a day is very easy. So there's little things that you can do that actually have a big effect on your feet, body movement, how you feel. And last thing is that your feet is so connected to your emotional state. That'll totally have to be a part too. But
Wow.
I'm very much obsessed with how we feel our feet, which connects how we feel our body. And I believe that we are in a very disassociated or disconnected society state. There's like a pandemic of being just disassociated. That's technology and AI, where that affects emotional states. And the more that we can feel our body, feel our feet, feel the ground and how we're moving, that has such an effect on emotion. That's part two.
Once we close this, I need to ask you, when can we have that next conversation? Emily, thank you so much for being here today.
Thank you.
Thank you for listening to the Dangerous Women podcast. If you had any groundbreaking takeaways from today's episode, please tag us on social at the Dangerous Women podcast. To make sure you never miss an episode, subscribe below.